You are most welcome to this talk, and the more observant amongst you will realise that we have Dr. Clare Craig with us. Clare, thank you so much for coming.
Thank you for having me, John.
And this is the second video we've done today, actually in person, which is pretty wonderful to have Clare here. Thank you so much for coming up all the way
Thanks for having me.
from way down south. Most people know Clare as a doctor. She is a pathologist. She is a medical researcher. How you get time for doing all these things, Clare? I wish I had 10% of your energy. It's amazing the amount of work you produce, including perhaps one of the best books written on the vaccine so far. We've actually reviewed your this one on the pandemic in the past. So we've looked at that, Expired. Also excellent. We will put the links to these available for very low cost. Spiked, Clare. We're going to look at a few slides. But just as an introduction to this video, so people can decide if they want to watch, what is this book about, and therefore what is this presentation about?
So it's a book about the COVID vaccines. It's a book about how they did not work and how they could not work and how people were silenced if they tried to tell you that. And I think it's an important story because other books about the vaccine so far have been about safety issues, but you can't have a conversation about safety because you get shut down and told it saved millions of lives. So that point has to be addressed first. So I'm addressing that point because it's simply not true and it could never have been.
I wish I had £1 for every time someone had said that to me.
Oh, no.
Based on a few ludicrous, preposterously optimistic or pessimistic, depending on how you look at it, models.
Absolutely.
I hate medical models.
Yeah, but these particular models are so completely unjustified. They're extreme, they're fantastical, and they're very easily taken down. Yeah. But of course, people have heard it repeated so many times that they've believed them.
Say often enough, people will start to believe it.
I know, and it has been said for years now.
Let's look at some of these slides, Clare, just as a way of illustration. There we go. Start us off, please.
Okay, so I just want to start off actually by saying who it's for.
Yep.
Because what I do when I write books is I write what I want to read, and I love learning when I read books. So I've tried to fill it with things that people might not have heard of.
Yep.
And that includes people who are very on top of this subject. I want everyone to learn something when they're reading it.
Yeah, but it is completely intelligible to the intelligent lay reader. You don't need. I found that very readable. Yeah. Intelligible.
And then I also want it to be read by people who haven't heard any of this stuff yet as well. And that's a really difficult thing to do, particularly on a vaccine topic. But I've tried my best to do it gently. I maybe shouldn't have put a black syringe on the cover, but I think you can just pretend it's a murder mystery or something.
Oh, no, I don't know. I wouldn't question that. So that's on that one. Now we go on to second screen. There we go. Yeah.
Okay.
Yeah.
So the starting point has to be a question that nobody ever asks.
Yes.
The question that was never asked is, if we'd had no vaccine, what would have actually happened?
Yes.
And of course, we were being told, based on modelling, all sorts of things that were clearly not true. And in retrospect, we've had a lot of time passed since, and we've had so many of these seasonal waves at the same magnitude, similar peaks, that we can say very clearly this is what would have happened. And so that has to be the starting point, because without that, you can't say, you can't make any measurement. You have to have a baseline, and that is the baseline.
And this is not based on modelling. This is based on empirical observation of previous years and subsequent years.
Yeah, exactly. Just looking at what happens in the real world.
Yeah.
And of course, we were told extreme promises. So there's a whole chapter of extreme promises that we're told, ranging from ending the pandemic, stopping hospitalizations and deaths, 95% effective. If any of those things had been true, COVID would have been over in 2021. And in fact, people were saying that as well, weren't they? We'll see the end of these waves, the end of this transmission, because the pharmaceutical claims were that is what would have happened. And it did not happen, and it could not happen. And of course, everybody's caught COVID since. And yet this this kind of promise of, we're ending this. If you get injected, you won't get this thing.
The pandemic stops with you when you get the injection. The Joe Biden thing.
Yeah. And then, next to that, people then took the vaccines and got it. And of course, the public stopped getting injected because they could see it wasn't working. But the official line continues to be that it worked, even though everybody caught it. Now, vaccines are meant to prevent illness. These did not work. So that's the starting point. Or what have we got here?
We could effectively end this pandemic in 2021.
Yeah, and then later on in 2022, we had the Pfizer CEO saying 2 doses offer very limited protection, if any, because at that point he's trying to sell boosters. And in February, the case rates start to rise. So we had this situation where the public health authorities were trying to measure the rate of infection in the unvaccinated and various different dosage categories of vaccinated. And for a long time, it looked like the unvaccinated were at a higher rate, probably because the number of people who were unvaccinated wasn't measured properly in the population. And then over time, the rates in the vaccinated were going up and up and up and up and up until they overtook this sort of exaggerated rate in the unvaccinated. And then they just pulled the data because it got too ugly for them to keep sharing it.
Well, we don't want the public reading inconvenient data.
No. In fact, the first thing they did...
I mean, they're such children, they won't understand it.
The first thing they did was they changed the case rates in the vaccinated to be printed in pale grey ink instead of black ink. Do you remember that?
Yeah.
Just sort of, please go away. We don't like this result.
Let's pretend it doesn't exist.
Yeah, indeed.
Hang on, you'll need to go to that. Yeah.
Okay.
Yeah.
And then in a Gallup poll was done where they asked in the US how many people had COVID and when. And of course, some people had died of COVID, so they're not in the survey, but you can do the maths to figure that out. And there were 350,000 COVID. Oh, so this isn't the Gallup survey. I'm sorry, I should have revised this. This is just COVID labelled deaths in the US. There were 350,000 in 2020.
Yeah. This is the overall sort of mega data sort of thing.
Yeah, and 470,000 in 2021. So where's the benefit there? And that is a problem data point.
Yeah.
And then of course a COVID labelled death is not necessarily a death because of a virus. There were all sorts of reasons why people were dying in excess and being labelled as being COVID deaths. Yeah. So first of all, there was the overdiagnosis problem, where people were being described as dying from COVID when they were dying from other causes.
Correct.
And as the COVID wave rose and fell, people dying of cancer, people dying of heart disease, those deaths were disappearing at the same rate and then reappearing when COVID disappeared again. So it was really quite clear we were massively overdiagnosing. So
as if COVID is like protecting you against cancer deaths. Yeah, it's just ludicrous when you think about it.
It's literally people who were dying of cancer who at any other occasion would have been called a cancer death, and it was called a COVID death because of a positive test result, and that was it. And that's not the truth, is it? That's not the whole truth. But the deaths are reduced down to this one word. Yeah. And then there's this problem that we have where people who are dying tend to have, one by one their organs fail. And one of the things that fails is their immune system. Yes. So if you go and swab a load of people in a morgue who've died of any cause, a large proportion of them will have a respiratory virus positive test. Of course. And this is not something that was a problem in life. And it was not something diagnosed in life, but the numbers are huge. So 47% of people in a morgue will have a positive respiratory viral test result, and 7% will have a positive coronavirus respiratory test result. So if you're swabbing the dying, you're going to get positive results, even when those people are not dying of that virus. Mm-hmm. So it's not a good test to do on the dying, but that is exactly where the testing was concentrated. In fact, we even had people testing in the morgue after people had died. In
fact, if you're testing people that are dying for anything, if you feed them ice lollies or something, if they're dying anyway, they're going to die. That, and you could blame it on the ice lollies, but it's not.
No.
It's again, it's so obvious, obviously wrong.
I think one of the things that's happened is that deaths have been reduced to a single diagnosis when deaths aren't like that. They're complex. And the CDC are good at publishing death data where they say multiple different causes. But the UK data always gets reduced down to one cause. And when you've got, this kind of political environment we've been in, COVID becomes one of the one causes, and any other cause that was mentioned just disappears out the data, and you're just left with COVID. Yeah. So then in the US, there was this problem where there were these incentives that were increasing the rate at which people were diagnosed with COVID. So families were getting $9,000 of funeral expenses if there was a COVID on the death certificate.
It's a lot of money.
That was happening up until September 2025. It was still going.
Was it as late as that?
It was as late as that. Yeah.
Wow, $9,000 if you put COVID on the death certificate.
Yeah, and so if you're a doctor who wants to help out a family, you'll put it on.
Well, I mean that's the difference between having a funeral and not having a funeral. I mean, $9,000 is a huge amount of money for poor people. It is. It's quite a lot of money for anyone.
Yeah, and if you're a relative who gets at the receiving end of a death certificate and $9,000, you're not going to complain too much, are you?
Go on, Doc, put COVID down for me.
No.
Come on, you can do that.
Yeah, so that's not a good way of collecting data, is it?
No, it really is. It really is not.
Yeah.
Yeah.
And then there was a problem that people were not being treated the way they normally would be.
Yeah.
People who had a community pneumonia would normally get seen by a GP.
Yeah.
Bit of face-to-face attention.
Pneumonia is a medical emergency.
Yeah.
Yeah.
And you'd get given antibiotics.
They'd be straight into A&E. They'd be on, get the blood cultures done. They'd be on oxygen. They'd be.
But even in the community, if they weren't that sick. Not everybody has to go to hospital. They still get antibiotics.
Oh, yeah, for sure.
And they weren't getting antibiotics even in the hospital.
Yeah. And
when they were dying.
If the SATs went down, they were going to hospital for oxygen.
Yeah. And all the pandemic plans were to stockpile antibiotics because this was, secondary bacterial infections are a serious thing that definitely caused people to die because antibiotics work.
Yeah.
And yet, instead of having an increase in prescribing, the prescribing fell through the floor. Now, if you think antibiotics save lives, and I do, then if you stop prescribing them...
I've seen untold numbers of lives saved by antibiotics, yeah.
And then you stop prescribing them, you will get excess deaths. And so, not all of those deaths were COVID deaths because people were denied antibiotics.
People were dying of bacterial infections when antibiotics were just sitting there doing nothing.
Yeah, because of this idea that viruses aren't helped by antibiotics.
Yeah,
the reality...
Which is basically true, but...
Well, it's sort of true.
Sort of true.
So, azithromycin, for example, is anti-inflammatory, which is good for viral pneumonia.
True.
And it has antiviral properties, which is good for viral pneumonia. And it stops secondary bacterial infections.
True.
So... it's not as black and white as
it's presented. No, it's not. Absolutely, yeah.
And then the last one we've got there is dehydration. So, people in care homes are there because they need care. And a big part of that care is help staying hydrated.
Yeah.
And when staff are, first of all, not there because they've been told to isolate, or not there because they're scared, or not there because they think that if they go into this room where someone's been described as COVID positive, they might be risking their family's lives and they don't have the PPE they think will save them and they don't have enough PPE, then you are not having enough contact with the elderly to keep them hydrated. Yeah. And these are people who are frail, and if they're not kept hydrated, it can kill them.
Oh, these patients become dehydrated really quickly. We know this in hospitals because some of them are catheterized, and you can see the urine collecting in the bag, and it goes dark coloured really quickly, and the volumes drop off.
Yeah.
So you get small volumes of really dark concentrated urine really quickly. And of course, that means that the fluid in the body drops. It means that the fluid in the secretions drop and the secretions become thicker. And you're really into a vicious circle then.
Yes.
Even in hospital, this is a common problem.
Yes. And I think also it was a problem in hospitals because the catering staff were, nervous and the people who normally help with this stuff are the visitors, and the visitors weren't there.
And the relatives all give the nurses a shout saying, "Oh, my dad's thirsty." Yeah,
or they'll help them. They'll help them actually drink themselves.
Yeah.
And so if you ban visitors, you ban the care that visitors bring.
Yeah.
And that's what happened. So I think all of those things cannot be discounted as a cause of death.
Yep.
So then we're on to, what would happen without a vaccine? Well, this tsunami is what we were told, weren't we? We were told 85% would have it in the first wave. That was Neil Ferguson's model. Now, when you look at, do you remember the test and trace that cost us £37 billion?
37 billion. What does that even mean? It's a massive amount of money.
Absolutely
for
vast.
Nothing.
And it created the most expensive data set in the world.
Yeah.
Where they had measured when people had a positive test result in a household, did other people in this household that then got tested, did any of them then test positive? And from that, you can work out a thing called the household transmission rate or the secondary attack rate.
Yeah, yeah.
And that tells you what percentage of people in that house then caught it. But if you look at it another way, it tells you what percentage of people in that house were susceptible to that wave.
Yes.
And so they measured it with PCR, and PCR exaggerates the numbers because you're breathing the air in the house, and it's far too sensitive, and it doesn't tell you anything.
Yeah.
But they later on measured it also with lateral flow tests, and so you can basically translate one test to the other in percentages. The lateral flow tests are what people were positive with when they were symptomatic and actually had COVID. So it's quite a good measure.
Yes.
By that measure, for every wave, it was 8.5% who were susceptible prior to Omicron.
But Neil Ferguson said 85%.
That's a big difference, isn't it?
Well, it's only a factor of 10, to be fair.
So what the implication is that if he's saying 85% in one wave and it's actually 8.5, that means it will take 10 waves
10,
at that rate
yeah,
before everyone's been infected. 10 waves. So, now, you approach that problem in a very different way, wouldn't you?
Totally. The idea that 8.5% of people get infected in any wave and only a small proportion of them getting sick. So this idea of people dying in the streets outside A&E departments. In fact, A&E departments in many parts of the country were so quiet that nurses and doctors were doing dance routines.
They were.
What was that about?
That was very, very strange. It was strange at the time, and it's even stranger now.
Very bizarre, really weird folie à deux of...
Yeah, with everybody sharing on these videos.
Yeah, how do you explain how... I'm still mystified looking back on that.
Yeah.
You know, I think some of my old tutors in the old days, they've had a complete fit. You know, anything that was considered unprofessional behaviour, they would tell you off.
Yeah.
You know, you had to have your tie, you had to speak correctly, you had to walk correctly, you know, as you should. It's a professional standard. And then people dance around in scruffy scrubs.
There was something going on there with
very weird.
There's a sort of hero worship thing, wasn't there? That
it was
the
bizarre.
People were celebrating the NHS and worshipping the NHS literally on altar cloths and projected onto church buildings at one point.
Well, you know, in the reality, it's only people like me work there. You know, it's crazy.
Yeah, but I think the people who were given that hero complex, that was part of the expression of it. Maybe. Yeah,
nurses and doctors actually came to believe their own image somehow.
It was very odd.
Very, very strange.
Yeah. So the other number on that slide there, that's 6%.
Yep.
That's where blood donors had their blood screened for antibodies over time. And it's about 6% for each wave acquired antibodies. So it's a different way of testing.
Yeah.
It might not capture everyone that was infected.
Yeah.
It might be more accurate, less accurate. We don't really know. But the point is that also was steady with each wave. So you've got two measures there of this tiny fraction being susceptible in each wave. It's a bit higher for Omicron again. But until Omicron, nothing changed. So nothing changed when all these people were vaccinated. It was exactly the same problem we had prior. The models were completely off and no one ever admitted it.
So 92.5% of people were essentially incapable of catching any particular wave.
Yes,
8.5%
they were bystanders. So just bystanders.
They were never going to get it.
Yeah. And this is because our lungs are lined by thick mucus, layer upon layer of it, and the final layer before you hit a cell is so impenetrable that a virus, despite its tiny size, a single virus particle on its own, it cannot pass that through that mucus.
Is that right? If it's
That's
intact.
Right.
Right.
So you have to have something go wrong to that mucus layer in order to let virus in. So sometimes they seem to maybe hijack on bacteria, which do have mechanisms for breaking through mucus. But sometimes something else is happening to that mucus layer that's letting things in.
Right.
One example will be COVID vaccines themselves disrupt the cytokines that cause thinning of the mucus layer.
Yeah, the local chemicals that are released by local cells that control the physiology in that area.
And so our mucus is so much better than any mask could ever be.
Yeah.
But it fails in a tiny proportion, each wave. So that's a really interesting question. Like, why is it that this mucus layer sometimes fails? Now, if we had approached this whole thing rationally, we could have done some research into that and found something out about it. But instead, everybody went crazy on masks.
It's amazing a virus can't get through, but the oxygen and the carbon dioxide gets through no problem at all.
Well, they're a lot tinier.
They are, but it's still pretty impressive that you've got a barrier that's so pervious to gases but so impervious to viruses.
Yeah, it's almost like it evolved that way or something. Really.
It's very clever.
Yeah, it's very perfect. It works brilliantly, and people lost faith in their bodies completely, in their immune systems. But the fact is, we breathe in a load of muck all the time.
All the time.
And so having this mucus layer that mops it all up, sweeps it all up with those hair cells, they just sweep it all up and into your
cilia
throat.
wafting it all up.
Yep, and then you swallow it and it hits the acid of your stomach and it dies. It's a good system.
Yeah, it is. It's amazing, yep.
Right, where are we on?
You're messing everything up again. Let's try again. Sorry, you need to go up again.
No, I'm not moving anything.
What's going wrong here?
There we are. Okay.
No, we're not on that screen there.
No, but at least it's on there.
This is me being silly. It's nothing to do with Claire. There we are. There we are.
Okay. So this is one of my favourite graphs. This is a measure of virus levels in the wastewater in the USA.
Oh, yeah.
It's not a pure measure. They've had to do a bit of modelling because they didn't have measuring sites everywhere at the beginning. So the early numbers might be a bit, averaged out.
Yeah.
But broadly, that is the level of virus.
It's a reasonable extrapolation.
Yeah. And you can see this, like, something crazy happened with Omicron. There. That's the thing.
That's the Omicron. That spikes the Omicron, yeah.
That's that first Omicron wave one. When, if you look at the area under the curve, so the amount of space beneath the curve for that Omicron wave, and the area under the curve for the other waves, they're actually comparable. Yeah.
So it's actually quite, that big, tall, spiky one's actually quite thin.
It's very thin.
So it didn't last for long.
It didn't last for long. So the same number of people, approximately, were infected as for other Omicron waves.
Oh, right.
But they all were infected in very quick succession.
Right, so the number of people infected is the area under the curve.
Yeah.
Yeah.
So it just happened very, very quickly.
Yeah.
But the actual overall impact was similar. But ignoring that very big spike, what you see is a series of waves about the same duration, peaking in about the same level. And, show me on there where the vaccines came in. I can tell you because you and I know.
We know, but there's no way you can tell from the data.
No, you can't tell from the data. And what you see with Omicron, apart from that crazy big spike, is that the periods between the waves don't revert back to zero anymore. You've got them sort of hovering above the baseline still. So apart from that change, nothing happened before and after the vaccines. This is the same thing, just progressing over time.
So the vaccines basically did nothing there in that graph.
They did nothing. Well, if they did anything...
I know they caused a lot of adverse reactions.
So what the vaccines potentially have done here is they've created a situation where the first Omicron wave was very, very sudden. This was at Christmas time, if you remember.
Yes.
Everybody was being encouraged to get a third dose, and they did.
Yep.
And in that period, people are more susceptible. And then you get this very big spike. Potentially, it might not have been that. I mean, it was quite a big spike in South Africa, and there weren't very many vaccinated people there. And then subsequently with Omicron, you've got some kind of immune problem where it never goes to zero anymore. This is, it's bad. So things have not got better.
Hang on, we will get there. There we go.
Okay, so this is the point that it couldn't work. Like, this is something that's been known.
This could have been anticipated.
Well, it should have been. Like the reason that the reason we've set up HEART and had the confidence to speak out on all of this.
What does that stand for, Claire?
The health. Well, actually, we changed it, but so now it's the Health Advocacy and Research Team. Right. But it was once the Health Advisory and Recovery Team. Right. Yeah. But it's the same ethos. Yeah. So the point is that this was studied for decades. So the NIH, which was where Fauci worked, the National Institutes of Health in the USA, made a publication in the year 2000 saying that respiratory virus vaccines couldn't prevent infection because you don't get mucosal antibodies that can stop the virus getting into the epithelium. You just get antibodies in the blood. In the year 2000, this is stuff that was known and established and in the textbooks.
Yeah, the mucosal compartment as opposed to the intravascular or body fluid compartment.
Yeah, so it doesn't work. So you've got your virus coming in to your respiratory mucosa, and the only way to stop an infection is if you can stop it getting into the epithelial cells to replicate. But the vaccine's injected into the arm, it creates antibodies in the blood. And so, you've got a sort of it coming through the back door problem.
You're protecting the wrong place.
You're protecting the wrong place.
Hang on.
Yeah. And of course, a load of money was thrown at nasal vaccines afterwards because they knew that was true. So here's the thing. This is the quote from that year 2000 book. Rarely, if ever, induce mucosal immune responses that may prevent infection. They can't do that. In January of 2021, so this is, in December 2020, America approves the vaccines. A month later, Fauci and colleagues write in a paper that injected vaccines alone typically do not result in potent mucosal immunity that might interrupt infection or transmission. And he said, we might have to rethink this vaccine program. We're going to learn a lot in the next few months. So, this was an interesting time, January 2021, because actually through December and into the beginning of January, there was common sense being spoken, people being rational. They're saying we're never going to vaccinate the children, we're going to aim at particular groups. Correct. And then this weird thing happened where suddenly it switched and everybody was singing about it and crying about it, and it became highly emotional. It was very, very strange. And then after that period of vaccine worship, we got to January 2023, and Fauci again publishes with some colleagues in a paper, it is not surprising that none of the predominantly mucosal respiratory viruses have ever been effectively controlled by vaccines. So, they could not work. They knew they could not work. They pretended for a few years that they could, and then they went back to saying they could not work. And nobody's holding them to account for this.
No.
So how did it...
Contradict yourself all you like and the world ignores it.
Yeah, it seems that way. Yeah, if you've got a position of authority, then whatever you say is true, even when it makes no sense, it seems.
Yeah.
Which is maybe a human societal thing, but it's something we really ought to stop.
Yeah. Well, that's it's just the antithesis of science, isn't it?
Yeah.
That's the whole point. Yeah.
Absolutely. So then the question becomes, if they didn't work, why does everybody think they did? And that comes down to the clinical trials, but actually there was a lot of research papers claiming they worked.
Yes.
And this is almost entirely down to one statistical trick. There was a few other statistical tricks, but most of it is this statistical trick. Yep. So what was happening was people were getting injected with these new products. The products were designed to make the cells around your body produce this foreign spike protein.
Yes.
And probably other foreign proteins because the message was slipping.
Yeah, cells all around the body.
Yeah. And then when that happens, this mucus barrier thins because of the cytokine damage. And a very important cytokine called interferon was suppressed. Now that's like the general of the immune system that tells the immune system what to do. And it was taken out for a while by the vaccine.
And the interferon does have antiviral properties, doesn't it? I think.
Yeah. And it's just not functioning for a while. So you've just disarmed the army. And then what happens is effectively that person has immune suppression. Yes. And their risk of infection is far higher than it would have been if they hadn't been vaccinated.
Yep.
And so what we saw was a surge of infections in that first 2-week period after the injections. And it wasn't just COVID. Shingles rates were 40 times higher than expected.
Wow, were they all infections higher? So shingles, that shingles measure was from a clinic with patients who had rheumatoid arthritis and were immunosuppressed. So that's a quite good population to measure it in because you get high numbers and you can actually see it.
So in that population, it was 40 times what you'd expect. But there were papers showing herpes simplex virus went up, herpes zoster virus, shingles, CMV, EBV. So basically, viral
These are different
control.
viruses.
Yeah. All of the viruses, apart from COVID, in that list are DNA viruses. And they're all viruses that we know go latent in the body.
Yeah.
So COVID is an exception. Well, SARS-CoV-2 is an exception there because it's RNA. And it probably, respiratory viruses generally don't go latent as far as we know. But nevertheless, these infections were all occurring, including COVID. So that's what happened in the first 2 weeks. But what did they do? They said, oh, the vaccines can't do anything in that period, so we should ignore it. And so they pretend those vaccinated people didn't get sick. And then on occasions, they described vaccinated people in that 2 week period as unvaccinated. So as well as ignoring the vaccine people who were sick, they were putting those illnesses onto the unvaccinated group and exaggerating the problem for the unvaccinated. So you've got a sort of double whammy.
Double whammy, yeah.
Yeah.
Pretty sly trick, really.
It is a sly trick. And we were calling it out, and it's never been addressed.
No.
And people have continued to publish and ignore that 2 week period. And I only ever managed to find 2 papers where they published on the incidence of COVID in a vaccinated population for the whole wave. So like from the moment the injection went in the arm right through to the end of the wave. And it's only with data like that that you can say, well, over the course of the wave, 8.5% of the unvaccinated got sick. And over the course of the wave, 8.5% of the vaccinated got sick too. Only theirs was all sort of in the earlier period. But people just were hiding the data.
Makes it so clear, Claire. Yeah, it's just... So that one and that one. Try now. There we go.
So this is the trick that I've shown.
Oh yeah.
So this is, if you look at it with smiley faces and unhappy faces. So if you look at the top row is unvaccinated, the bottom row is vaccinated, and the totals at the end are the same. You've got the same number of unhappy people, but it's just spread out differently. So the vaccinated get it all in that first 2 weeks, then afterwards they're done. And the unvaccinated, I've done it as if we're sort of coming off the top of a curve, which we were at the time.
It's good,
So it's more in the first week than the second and the third and the fourth. But if you only measure and compare week 3 and week 4, you look like you've got a very effective vaccine. And you didn't. You just made people sicker earlier.
It's a complete... I guess the correct word is illusion. In psychiatry, an illusion is a misrepresentation of actual events.
Yeah. I called it the illusion of benefits in the book.
Which leads to a delusion, which is a false belief.
Yes.
A rather expensive false belief, it has to be said.
Expensive in many ways.
Yes.
So, one of the costly parts of this is that if you have a population that are going to get COVID in that way, but you make them immune suppressed, then first of all, a higher percentage get it.
Yep.
And second of all, they're very sick when they get it.
Because they're already immunosuppressed.
Because they're already immune suppressed. And if you make all these people have their infections earlier, then rather than protecting the NHS, you're bringing forward all of the infections into January in the most frail people and overwhelming the NHS, which is apparently what we were trying not to do.
It's exactly the opposite of flatten the sombrero that Boris Johnson talked about, wasn't it? Yeah,
that's exactly right.
Wait till I go back onto this. Go from that one to that one to that one. There we go.
So this is a graph of late 2020 into spring 2021.
Yes.
And the little dotted line there are COVID labelled deaths in Europe. And you can see they had an autumn wave that was bang on the same as the UK one, which is a solid line.
Yeah. So the first part on the left is all the.
Yeah. And then we had this rollout that they're so proud of how quick it was.
Yeah.
And look what happens with our rollout. We have all of these cases, like a witch's hat on top of the winter spike.
Yeah.
And at the end of it, it's done. Like, all the people that might die have died.
It's way near the baseline,
So by spring 2021, it's over. Whereas the rest of Europe, who were much slower at doing all of this, had a much more gentle, spread out wave. Well, is that what we really wanted? Because that's not great. Yeah. And then when you measure the area under this curve, so again, that's the number of people that did die, it was 13% higher in the UK than in Europe.
And that's before we even mention midazolam and morphine.
It is before all of that. Yeah. It's just comparison, comparing like for like. Yeah. That we were, doing the opposite of what we were meant to be trying to do.
Yeah. Victoria's.
Now?
We'll get the second screen. Try now. There we go.
Oh, okay. So this is a delusion.
Delusions, good.
Yeah, so the delusion was, come on, well, let me see, get a vaccine. And once we've injected you, you are unvaccinated for 2 weeks.
So by being vaccinated, you're unvaccinated.
That's it.
Yeah, makes perfect sense.
And then, of course, that delusion only works when you've got this delusion that the whole world is going to catch fire.
Yeah.
That was what we were told. The whole world is about to have this catastrophic fire. And we were going to give you all fire protection systems. Mm-hmm. And when the fire protection systems end up
causing fires,
shorting and causing fires, we're told that it's too soon for a fire protection system to have had a benefit. And therefore the fires are not the fault of the fire protection system. That's basically what happens.
Yeah.
And then when all the sprinklers go on and people get other harms, they're told it's a coincidence and nothing to do with the protection system. And if you talked about the fire protection systems and said that you didn't like them, you were anti-fire protection system.
Yep.
That's my little analogy.
Yeah, that is a good analogy.
So this is back onto that number that I was trying to quote earlier, the Gallup poll, where they asked the Americans who'd had COVID. And if in 2020, based on this poll, 85 million cases there were. And there were 116 million cases in 2021. Now, if the vaccine had reduced the case fatality rate, then the percentage of cases that died should have been lower in 2021.
Of course.
It was 0.4% before and after the vaccines.
Yeah.
So you've got the same number, we've got more deaths in 2021.
Yeah.
You've got broadly a similar number of cases and deaths and the same death rate. So where's the vaccine benefit? So it's not just that the infections weren't stopped, because the death rate's the same.
Death rate was the same, yeah.
And so, the 20 million lives saved claim is really all they've got left. All they've got left is the model data. And, I've just listed off here some of the things that are in the book, some of the examples of things that should be obvious to say this worked. So one lovely one is when you compare COVID deaths in Israel and Sweden, which coincidentally had a ratio of 2 all the way through. So Israel's quite a young population, Sweden's older. But the two lines map perfectly at a ratio of 2. Israel went hard and early on the vaccines. Sweden didn't. And there was no difference.
So twice as many people in Israel?
No, in Sweden. The rate's higher in Sweden because they're older.
Oh, right. Okay. Yeah, of course. Yeah.
But the point is that they vaccinated at very different times.
Yeah.
And so the lines should have deviated for a period. And they don't. And that's true. Every time you try and find these examples, you don't see the benefit that there should be. Yeah. And besides which, if there was a massive benefit and there was the claimed risk, where is this country that didn't vaccinate very much, where lots of people died? Where is their sort of pitch postcard country they always point to say everybody died here because they didn't get the vaccine? There isn't one because they can't. There's a lot of African countries that didn't vaccinate.
Oh, yeah. I know my friends in Uganda, hardly any of them.
Yeah.
Everyone got sick with a cold.
Yeah.
For about a fortnight in 2021, and that was it.
Yeah. And I mean, they were a young population overall.
True. But even the older people weren't getting.
Yeah, and there's HIV positive people there who are high risk.
That's a really good point.
Yeah.
Yeah, I mean, you're probably talking about, I'm not sure about Uganda, but some African countries you're talking about 10-20% of the population are HIV positive. Yeah.
And there were COVID deaths to measure beforehand, but nothing got worse compared to elsewhere. So, you know, that there is no control group they can show to say this is what would have happened if we hadn't done it. And then these are more US wastewater graphs, which I quite like. So we've got the solid black line is the level of virus up to the point where Omicron comes, and I cut the graph off.
Right.
And on the left, we're comparing it to hospital admissions, which is the dotted line. And you can see that it maps very, very, very closely.
Yeah.
And the two lines separate in autumn of 2021. And then later, like December 2021, Omicron comes along and they separate in a big way. But they do separate just a little bit there. And I think what was happening in autumn 2021 is the US had done a big push to get monoclonal antibodies. So these are antibody treatment where you've got an antibody to the virus that you can give someone in an IV drip.
Yeah.
And it was shown to reduce hospitalizations.
Yeah.
And they were out there with all the high-risk people, giving them these strips in their homes to stop them coming into hospital. And I think it was working a little bit. Reduced hospitalizations by about 6%. And you can kind of see it in the population data.
It does make sense. The trouble is that the virus mutates so quickly that the mAb would be out of date very quickly. But
well, yeah, it didn't work for Omicron until they stopped using it, which is interesting because they admitted that the monoclonal antibody to the spike that was working a little bit did not work for Omicron, and yet they were claiming that the vaccine antibody did. I mean, they were still injecting people in December 2021 with the Wuhan spike.
Yeah.
And we know that antibody did nothing.
So the antibody doesn't work, but the antibody generator mysteriously still does work.
Yeah.
But of course it doesn't.
Yeah, and then 2022, they were injecting children with the Wuhan spike. It was outrageous to be doing that. Yeah. And then that graph next to it is the deaths. So the black line is the wastewater and the little dotted line is the deaths. And now what you see is that in that same period with fewer hospitalizations, the people who were going to die still died. Yeah. So it did keep people out of hospital, but it didn't actually affect the death rate at all.
Save them lives,
No. And so if you've got no separation between excess deaths and wastewater levels, then you haven't succeeded, have you?
Correct.
Oh, and then so this is the fantasy claim graph. So the graph on the left is all of the COVID labelled deaths in the world. Accumulating over time, so it's a line that can only go up.
Yep, of course.
And it it goes up at a particular rate up until the end of 2020.
So the steepness of the curve on the left is
that's the key
number of deaths. Yeah,
and then the vaccines arrive and it gets steeper, but it's pretty constant. And then at the end, Omicron arrives, a third is deadly, and you can see it plateau off. You can see this changing gradient, and there's far fewer deaths accumulating. Now, what Omicron shows there is what the vaccines were meant to do. They're meant to flatten this curve off. And where is the flattening? There is no flattening.
The vaccines didn't do it, but the Omicron did.
That's right. And then this graph on the right is actually the same graph. The solid line is the same line, and the dotted line is what we're told would have happened if we hadn't had vaccines. You're like, well, hang on a minute. Why would it suddenly escalate to that degree? There's absolutely no reason to think it would have taken off like a rocket. But that's what they claim. So that was the third delusion, was that the vaccines made Omicron less deadly.
No, Omicron was intrinsically less.
And it was a sparkler, not a flamethrower.
Yes. Good analogy. Yeah.
And so then we get to the point that people weren't told any of this and still haven't heard this. And so they find it really hard to believe. Like I've said all of that and people cannot believe it because they've had years of being told the opposite and told it in sound bites and told it repeatedly, told it by people in authority when it was not true. And they can't get their heads around that.
Mainstream media, if it's on TV, it must be right.
Mm-hmm.
Yep.
And the fact is that, first of all, dissenters were being punished. People were seeing dissenters being punished and didn't want to join in because they didn't want to have any of that. Careers were destroyed. They still are being destroyed currently.
In Australia, it was appalling. Yeah.
It's going on in Ireland.
Yeah.
Right, 5 years later. And then there's the problem that, the authorities sort of started to hide the data when it wasn't convenient.
And still are. There's all sorts of data not released. We don't have the excess deaths related to vaccine status.
No.
The government have released that data to the pharmaceutical companies, but not to you.
That's right.
Outrageous.
Yeah, we've also got the vaccine safety reports when they started to look nasty about arrhythmias and heart disease, that those have still not been published. And they were being published. They were sharing the previous reports. As soon as it looks uncomfortable, we're like years into not being shown them.
Yeah. No, all sorts of data streams just disappeared.
Yes.
Yeah.
And then there's a peer review problem, which is a problem that's been going on for decades.
Yeah.
It's a problem that the editors of the journals themselves have acknowledged.
Yes.
That there's, basically the system doesn't work as a healthy gatekeeper. It's an unhealthy gatekeeper. It's corrupted. And so if the press rely on peer review as their measure of quality, they're relying on a corrupted measure.
But it's not only that. I mean, all the national guidelines, the NICE guidelines, National Institute for Health and Care Excellence, generate their guidelines based on peer-reviewed publications. And they say, well, if there's no peer-reviewed publications, there's no evidence.
And in the world we're in, it's absolutely insane that we have these publishers as a barrier.
Yeah.
Well, they're just massively profit-making.
Yeah.
For no benefit. There's no public benefit I can see there.
No.
I think we should have abandoned
It's a real legacy shackle, isn't it?
Yeah.
It's a millstone round our necks that's been there since, well, I suppose it goes back to mid 1850s and things like that, when the only way to publish something was on a hot piece of metal.
Yeah. Which is fair enough to have a publisher then.
Yeah.
But at the moment...
But now publishing's not too big of a problem, strangely enough.
No, it's cheap and free. And, I mean,
Well, you and me have both done it ourselves.
Yeah. And so we should be seeing science published and shared and publicly peer-reviewed.
It really is annoying that, we're paying for this research through our taxes.
Yeah.
Then you have to pay again to read it. It's just outrageous.
Yes. So I don't know I don't know when we'll ever get to that stage, but we need to get there. We do. It's
like vested interest is got an interest in maintaining this legacy system that discriminates against the majority of us.
Yeah. And then we've got this silly, crazy situation where the Pfizer are telling the FDA, the regulators, they didn't understand the mechanism of protection. Of course, they didn't understand the mechanism of protection because there wasn't one, exactly. But they're happy to say to the regulator, we've no idea how this thing is working. And then the public gets told it's safe and effective.
Yeah.
You're like, well, that's a big disconnect there, isn't there? And
Yep.
Yeah, and you can't have informed consent when...
That was the thing that really got me. I actually had 3 of these things before I rambled. It was a bit of a con, and it means I couldn't give informed consent because the information wasn't there in the public domain. You simply couldn't get it.
No.
It was controlled. In our great democracy, information was controlled.
Yeah.
And we weren't allowed it because we're just the plebs.
And what some people might say to that is, we didn't know all of this stuff about the safety at the time, and we didn't know how effective it would be. You're like, well, okay, I think there's some truth in that. It's not entirely true, but there's some truth in that. But the point is, you can still communicate uncertainty. And for example...
Yes. But even with the phase 2 studies, there was obvious biodistribution, for example.
Yeah. And for the Pfizer vaccine in particular, in their phase 3 trial, which are 22,000 people in the placebo and 22,000 people in the vaccine group, of that, the people they selected... there was a certain number that were dying. Now, if their product had caused the death, this is hypothetical, just the maths. If it was possible that product had caused the death of 1 in 4,000 of the 22,000 people, it would not have been statistically significant. Which means that at the end of that, when you've got the trial result, you can say to your patient, this is still a new product. We haven't tested it thoroughly, but I can tell you that it doesn't cause death at a rate of more than 1 in 4,000, but I can't reassure you that it's that or less than that. And that's the truth. That was the level of information that people had available. There's no way anyone was going to say that, were they? Because it was just safe and effective, and everyone was a bit hysterical.
That's what we were told. Yep.
Yeah.
That's
I mean, I don't think it did
politicians
kill at
told us.
that level, just to be clear.
No.
It didn't.
No, but
that's the knowledge.
The actual power of the statistical technique, that was the level of detail it could penetrate down to.
Yeah, because with the trial, even a trial that size, there wasn't a difference in the death rate because the thing they were trying to measure wasn't very deadly. You know, if you've got 22,000 people and you can't see any difference in these severe outcomes, because it's not really much of a problem.
Whereas if people were being shot in the head, you would see it with a much smaller number.
You would.
More people would die. Yeah. Yeah. Well, just that one. I'll try now. There we go.
So I just thought I'd put in a note about vaccine safety.
Yeah.
So I do mention it a few times in the book, but it's not the focus of the book. So the focus of the book, as I said at the beginning, is about efficacy, because I just think that's a really, really important story that people just haven't talked about. It's not really being addressed. You know, there's a lot of people concerned about safety, and people don't talk about the efficacy problem.
It's not safe and it doesn't work.
And the efficacy problem, of course, relates to, you know, what they're trying to do next. When we've got, whatever was it, £100 million? No, sorry, 100 million doses per year of Moderna being produced on a government contract in this country, with potential for it to be higher if it needs to be high. I think, well, who is being injected with all these things?
Like 1.5 injections per person per year.
Yeah, with a product that didn't work when it was trialled in this massive way.
And has huge amounts of adverse reactions.
Absolutely. And, you know, governments don't like admitting that they've signed contracts and wasted public money, but that's what they've done, and they need to admit it.
On a scale which is like off the scale.
Yeah.
The amount of money that we've added to the national debt is, I suppose some people might be able to calculate it, but it's incalculable and enough to revolutionise many parts of the country if it had been used properly.
I know, it's really tragic. It's awful.
Yeah.
Okay, so that's my conclusion, I think. I did 1,372 references. It's a bit of a reference textbook if
Tell
it's
me
nothing
about
left.
it. Yeah, I know,
It's
it's a huge number. Yeah.
Yeah. And I was also, because, you know, I wanted what I'd learned to be written down somewhere. Yeah. Because I just think we have to have these written records.
It's a historical document, isn't it? I mean, it's And when you read this, it's kind of gratifying. You think, oh yeah, that's right. That Claire just puts it in a way that vents your frustrations in the proper way. But it's so important because we need to not make these mistakes next time round.
That's right. Yeah. That's right. And I've just to add, it's not all maths. And
it's not at all. No.
So I've got stories in there. I've got all of these quotes from these officials as we went along the way.
Yeah.
And I've also got a whole load of stuff about the censorship and what that was like, and in fact what happened to me in terms of the GMC and all of that stuff's in there too.
Yeah, I mean, I was censored just for making a few videos and particular things. You know, some world-leading doctors I talked to, I was censored for talking to them. It was just...
I made
ridiculous.
I had an interview on GB News at one point, and they put it up on YouTube, and it was a fine interview. They were talking about vaccine side effects, which was controversial at the time, and I just I didn't want to get their channel taken down, so I thought I'll talk about Guillain-Barré syndrome because the government have admitted that one. So I just focused on that one thing,
the paralysis,
right? So that there was no issue there. You know, it was just an example of how you approach these things. And my mum wanted to see it, and she couldn't make it work. And I thought, well, I'll just put it up on my YouTube channel, and I can share it with her on there. So I shared it in a private setting on my YouTube so that she could see it.
Really? Yeah.
And I got a strike. You know, well, how come GB News are allowed it and I'm not?
Yeah, and Twitter, of course, in the early years, pre Elon Musk was terrible, as was Facebook. I'd put something on Facebook, and some fact checker would come and talk a load of drivel about it, you know.
There were fact checks all over the place, weren't there? But I mean, Twitter at the moment is thankfully allowing us to talk about hantavirus and what's really going on there.
Yeah.
But there are a lot of people I know who have got voices that ought to be heard, who are saying important things, who are not. You're one of them. You're not on it at the moment.
No, I got hacked.
Yeah.
Professor Fenton.
Exactly. He's not on
Yeah,
it.
yeah.
And people who are on it officially are completely shadow banned. You know, nobody sees what they say. So what's the point?
Yeah.
So it's not as free as people think.
Yeah. I know a guy who knows a guy who knows a guy who knows Elon, so we could maybe send a message. Yeah. Claire, great stuff. Claire's books are available. So Expired on the COVID pandemic, and Spiked, A Shot in the Dark on the vaccines and some of the stuff we've just been looking at. I'll put the links. Get them, buy them, read them, keep them for the next generation. They really are an important historical document. As indeed, hopefully, are these videos, which you've shared all the same information. So that's brilliant. So as always, Claire, thank you so much.
Thank you, John.
It's been great, and thank you especially for coming up. It's been tremendous. Yeah.
Thank you.
And we'll talk soon.
All right. Bye-bye.
Bye bye.